Okay, again, I'd like to welcome everyone to our Provider Enrollment Revalidations webinar. My name again is Leanne Foster, and I am a Provider Outreach and Education Specialist here at WPS. And again, I'd like to welcome you to our webinar this morning. One item of housekeeping I do need to take care of before we get started with today's agenda is training material. Training material is available for today's session, and a link was placed in the chat for you. That link will take you to our training center, and you're looking for our live events. There you can see our list of upcoming events, and one of the first ones should be today's session, which again is that Provider Enrollment Revalidation session. You'll see a link to register, but you'll also see a link for training material. If you click on the link for training material, you will be able to download the material for today, which is the PowerPoint and the slide deck that I'm sharing with you today. Also, as I stated just moments ago, we are recording this session. This session will be available on our website under our Encore presentations link on that training center for 60 to 90 days without the need to access our YouTube channel. We recognize not everybody's able to access that channel on their work computers, so we're giving you that option. Again, it'll remain there for 60 to 90 days. After that, the recording of this will continue to be available on our YouTube channel as long as the material is relevant and accurate. For questions today, we are leveraging the chat, as I mentioned, and Karen is monitoring that. I will be checking in with her a couple of times throughout this presentation, and I encourage your questions. However, I don't want you to feel as though you have to wait until I check in with Karen for questions. I don't want anyone to forget their questions. So go ahead and throw those questions in the chat as you have them, and we'll get to those as time allows. If for some reason time does not allow for all of the questions that we get today, that is okay. I will be creating a follow-up document with the questions and answers that we did not address in today's session, and that'll be sent out to all participants so that you have all of that information. Also, at the end of this webinar, you'll be given the opportunity to provide us with some feedback. And this feedback is super important to us for evolving and improving our education. So I'd really appreciate it if you would take a few minutes to complete that at the end of the day today. So we want to hear from you. What did you like? What could we do better? How could we better serve you with our education? We look at all of that and we, again, use that to evolve and improve our education. Also, it's an opportunity for you to provide feedback on topics that you'd like to see in the future. We do look at that so that we make sure that we're offering you the education that you would find helpful. And last piece of housekeeping is our disclaimer. The material presented today is an educational tool and is accurate as of today. If you have worked for Medicare for any length of time, you know the one constant is that the program changes and does change often. So with that, this material is accurate as of today. I do encourage you to continue to monitor official CMS communication, which includes not only the CMS website, but our WPS website for all changes so that you ensure that you're following all current Medicare rules and regulations. And then lastly, CMS does prohibit the recording, screenshotting, or photographing of this material for profit-making purposes. And as stated a few moments ago, I am recording this session, so you will have that recording available to you. Should you want to see something else, had a question, or if you know of somebody who might find this information useful, you can certainly share that with them. Okay, that brings us to our agenda for today. So today, the purpose of today is to provide you with an understanding of the provider enrollment revalidation process. We're going to talk about the purpose of the revalidation, why do we do it, what the triggers are, what is going to initiate the sending of that revalidation request. We're going to help you determine how and when you should submit your revalidation, and then what needs to be submitted in order to successfully revalidate, and then we're going to include how to submit that and give you some tips to ensure a smooth revalidation process to avoid any processing delays, hopefully avoid the need for any development on our end, asking for additional information. Now, I do want to point out that today's focus will be the revalidation process in general, and these are the processes that apply to all revalidations. However, we did receive a few pre-submitted questions regarding the current off-cycle revalidation that's in process, and this is specific to skilled nursing facilities. The information that we covered today will be valuable information to those of you that are currently going through that off-cycle revalidation for skilled nursing facilities. However, that off-cycle revalidation was requested due to new reporting requirements, which is specifically the new attachment 1 for additional disclosable parties. Due to that new reporting requirement and the detail that is involved in that attachment, we're not going through that attachment or SNF revalidations specifically today. That's actually an entirely separate class, which we have offered, and there is a recording available specific to SNF revalidations that goes through the items that might be a little bit different for SNFs because of the off-cycle revalidation, and it goes through that attachment. So I am going to be asking that a link is placed to that YouTube video or that recording in the chat so that you have that. That should also be available. We're still inside the 60 to 90 days that was last offered, so that should also be on our website on our training center under our Encore presentations. So if you're looking for that specific information about that attachment specific to SNFs, certainly I encourage you to take a look at that. I've also included a list of acronyms that I'll be using today. I'm not going to read through all of these, but this is available in your training material to assist you today. So let's start with the basics of a revalidation and the revalidation process. Starting with what is a revalidation? So at its core, if you've never revalidated before or are unfamiliar with the process, revalidation is a critical fraud prevention tool that ensures that all of our enrollment information is up to date. So we are requesting revalidations that will include the submission of an enrollment application to ensure that all of our enrollment records are accurate. Perhaps there are changes or additions or deletions that have not been reported. And this process also ensures that we have the correct data for claims processing activities, and it can help us avoid delays in that claims processing. But again, also it is a fraud prevention tool. A lot of that enrollment information is used to determine whether or not somebody should be allowed to have access to Medicare funds. So it's protecting that Medicare trust fund, but also the enrollment information comes into play with our claims adjudication process. Great example of this is practice location information. Our claims fee based off of the fee locality for the practice locations on file. And if a practice location is not on file, it is quite probable that a claim submitted with that practice location will be denied. And we want to avoid that. So CMS has set up this revalidation process. So revalidation applies to all providers and happens every 5 years. It will be requested of all active enrollments, whether that's an individual provider or non-physician practitioner, an organization, whether that's a Part B organization like a group clinic, or a Part A organization such as a skilled nursing facility or a critical access hospital, and also suppliers. So think labs, ambulance services, independent diagnostic testing facilities. Everybody who has an active enrollment, and you'll notice I keep saying enrollment, not provider transaction access number or PTAN. It is based on the enrollment record itself. If an enrollment record has been deactivated, meaning all of the PTANs on that enrollment are deactivated, we will not request a revalidation. But if there's even one active PTAN on that enrollment record, a provider could receive a revalidation request. Also, it's going to impact providers that are in multiple states just a little bit differently in that they may see more than one validation request. So for instance, if you have a provider who is enrolled in Michigan and Indiana, WPS is the MAC for both of those jurisdictional states. However, because of the way the claims processing system works, the provider is set up with independent enrollment records in each state. So when the provider is up for revalidation, they may receive a revalidation request for Indiana and Michigan, depending on the timing of the 5-year cycle. They might receive those 2 letters at different times, and that is completely normal and appropriate. So if you have that situation and you receive it for one state, not the other, revalidate the one that was requested. The other one is simply not up for revalidation yet. But we will show you how to determine that later on in the presentation. The other thing that can trigger a revalidation is what's referred to as an off-cycle revalidation. And I did mention this. So as I said, typically revalidation is every 5 years. If you enrolled in March of 2025, your first revalidation would be due March of 2030. That is typically how that process goes, and then every 5 years after that. However, CMS can request off-cycle revalidations, and this is happening, as I said, right now for skilled nursing facilities. And the reason they do that, it can be changes to the reporting requirements. With SNFs, there was a change to the CMS 855A, changing how they report their ownership and managing control information. That is a reason for CMS to request an off-cycle revalidation. Other reasons include CMS having questions about compliance of a particular provider, so they can do an off-cycle revalidation for one provider, or a particular specialty. Maybe they're seeing that there might be some indications of potential fraud within a provider type. It could also be localized based on geographic area. And it can be national initiatives. So that SNF revalidation, again, is an example of a national initiative as well. If there is an off-cycle revalidation, it does not change the 5-year revalidation cycle. An off-cycle done today will not preclude a provider from being required to submit their 5-year revalidation in the next couple of years. So an off-cycle does not reset that 5-year clock necessarily. Typically it doesn't. CMS can change that, but at any time if they so choose, but we're not receiving indications that that's going to be the case with these. So the timeline for revalidation, as I said, it's every 5 years, and we're going to talk more specifically about these steps, but this is an overview of it. When it is time for a provider to revalidate, the MAC will send out a letter to the provider requesting that revalidation, letting them know what PTANs are impacted, what state enrollment is impacted, and it'll give them a due date. Now that due date is typically 60 calendar days to respond. So they give you that timeline to coordinate all of the information that needs to go into that and to get that submitted. And that's 60 days to respond. If we receive an application, a revalidation close to the end of that 60-day time frame, your processing might take a little bit longer than that 60 days, but because we've received a request and it's in process, there's a good faith effort. It's not something that it's going to be counted as you having responded. It's incomplete, but we're going to count that it's responded until we process that application. If you fail to respond, and we'll talk about what happens for failing to respond a little bit more later, but if there's a failure to respond, the provider could see payment interruptions. It could be a stay of enrollment, which we'll talk about, or it could be a deactivation of the entire enrollment record. So it's going to be super important as we go through here. You'll hear me stress the need to timely respond to the revalidation letters to avoid any payment interruptions. So this is an image of what a typical revalidation solicitation will look like. This is for the 5-year cycle. If you look at the image on the screen, you'll see the first sentence underneath the deer is going to be every 5 years. With a normal revalidation, this is what it will say. If it's an off-cycle revalidation, that will be called out in the letter so that you'll recognize the difference. But it'll have the provider's name and address. It'll show the enrollment ID and the contractor ID, which also denotes that state. And then down in the body, it'll give you the date that your revalidation is due, along with the provider's name, the MPI, and the PTAN. And if we're revalidating multiple PTANs, say for an organization that maybe has 4 clinics that are enrolled separately, they're on the same enrollment record, it will show all of the PTANs on that enrollment record. If that were the case and they're enrolled separately, that's not common, but if they were enrolled separately, you'd receive separate letters. So keeping in mind, it's showing you the information that's on the enrollment ID in the letter. Now the due date, we do receive questions about that due date, and CMS and Max work together to determine that due date and to determine who is up for revalidation when. Again, there's the 5-year cycle, but with the pandemic in 2020, we did see some changes to those 5-year cycles. There were providers that were due for revalidation during the pandemic, and there were flexibilities and a pause on revalidations. So we are still coming out of that a little bit. However, that cleanup has been done, and we're now starting to get back into the regular revalidations. So I did see some questions where dates have maybe changed, and it could be something that was impacted by what I'm going to call that reset coming out of that pandemic. That's just taken some time. That was 3 years of not revalidating providers. So there's just a little bit of cleanup that had to happen. So with that, how do you know if you're up for revalidation? The date that you knew pre-pandemic may or may not be the date that you would know that you need to reval now. They're trying to cause as little disruption as possible and try to change as few revalidation dates as possible. But then we also had the off-cycle revalidation that we're working with. So the best way, besides receiving that letter telling you it's time to revalidate, when that letter is sent, then the lookup tool that CMS has available, that is the data.cms.gov. And I am asking that a link be placed in chat so that you have that. That website is an incredible tool for you to be able to determine whether or not your provider is up for revalidation. And I'm going to go out there in just a second, but here you have a screenshot of the search screen, which we're going to talk about. And then you're going to see the search results. And I just want to talk about those search results a little bit before I go into the website. So what you're going to see here is you're going to see the name. This, I did an individual search, which is why you see individual under that yellow #1 marker there. If it were an organization, it would show the legal business name. It's going to show you the due date, and here you'll see the TBD. And the TBD means that the provider is not up for revalidation. That is to be determined. So if you're looking up a provider and you see that TBD, they are not up for revalidation yet. They update them as those records are coming through. Again, we're kind of doing a little bit of a reset here. I can tell you that today they are sending out revalidation letters. Those dates would be available on the website because that will have been updated. The adjusted due date is something that was in place for the pandemic. That is not something that you need to pay attention to. That's why it's not numbered, because that's still there. They're keeping it for historical record, but it's not something that you're looking for. You're looking at that top due date. And then it'll show you the date, the specialty, the enrollment type, and if there are any providers that are receiving reassignment of benefits. So just a little bit of information on what that revalidation is looking for. So to show you that tool, I did give you a link, but I want to show you how to get there if you don't have the link from the cms.gov website. So from the cms.gov website, you'll want to go into the Medicare menu, that drop down. Under enrollment and renewal, you are going under providers and suppliers. Once you are here, you are going to see a link on the left side. There's a list. Click on the one that states revalidations. And here there's a lot of good information about revalidating online. We're going to talk through some of that on just the revalidation process in general. And the very first frequently asked question is that Medicare revalidation list. So this is that list. This is a national list, so you can search providers from all MACs. And you have a couple of options. You can do name, you can do state, and you can do MPI. And then there's also record types. Typically, I recommend looking up by MPI. This is a national list, so if you have a provider that's enrolled in multiple states, it could potentially be confusing, but the MPI will also pull up all of those, but what you will avoid is anybody who has the same or similar name. So I would recommend looking it up by MPI, and if you're only concerned about a specific state, you can certainly narrow down those results. So this information is out there for you and will tell you, show you the search results and tell you if your provider is up for revalidation outside of waiting for that letter. So what information do you need to revalidate? The short answer is everything. So you're going to be filling out your application as if you are a new provider. So this includes the identifying information. So we need the name, date of birth, social security number. Maybe a name has changed and it wasn't reported to CMS on your enrollment record. This is that opportunity. Changes do need to be sent in timely, but revalidation ensures that we get that information at least every 5 years. Any licensure or certifications that maybe have changed, there's probably a different expiration date. Maybe there's a different level of license that needs to be reported. Maybe there's a new certification. You do need to make sure that you're looking at all addresses on file. We'll talk about submitting this electronically, but if you have submitted and have access to PACOS, you can check your enrollment record in PACOS if you've submitted applications electronically in the past. And that's a real simple way for you to go out and see what information we currently have on file to know what's changed. And we'll talk through that a little bit more in a minute. But make sure that all the addresses that you're utilizing are reported. Make sure your correspondence address is correct. Make sure your contact information is correct. Ownership information, critical piece of fraud prevention. So make sure that the appropriate owners or managing employees are reported. Make sure that we have the appropriate authorized and delegated officials for signature rights. Maybe someone's left. Maybe there's someone you want to add as a delegated official to help streamline your business processes for completing these enrollment applications as new providers come in. That's also something that you can do. Reassignments, so particularly with individual providers, if a group revalidates, it's going to revalidate the group, not the individuals. It's about the group information or that clinic information. But individuals have to revalidate and reconfirm all of the groups that they reassign benefits to. So make sure that all of those are accounted for. And we do need to revalidate everything, not just for one of those reassignments to successfully revalidate a provider. It is about the enrolling provider, not the clinics they work for, the PTANs. And then again, as I stated earlier, this is an opportunity to report any changes, additions, and deletions that maybe haven't happened. Maybe you're about to submit a change and you happen to get a revalidation request at the same time. You could affect that change through that revalidation rather than doing two applications. However, if you have something that's changed a year ago, you really probably should have submitted that as a change, but this revalidation is going to give you that opportunity to submit that as well. Okay, we're going to pause there before we talk about submission to see if there are any questions. Karen, do we have any?
Liam, we have gotten a couple questions that have come through in the chat. The first one has to do with SNF revalidation and that due date, like you showed, being a to be determined. Providers are told not to send or not to submit revalidation until that due date can be established. Are you able to confirm that Medicare payments will continue during this TBD revalidation period?
So if it's a SNF revalidation, that is a little different. The letters went out with dates that were determined by CMS. And because of the amount of information that was requested, CMS did grant an extension to May 1st of 2025. Payments will continue until May 1st of 2025. So we have about a month. You do need to get that revalidation. It's critical that you get that revalidation sent in prior to that 5/1/2025, because on 5/1/2025, barring any action from CMS that extends that, which we have not received communication that that's going to happen, they would place what's referred to as a stay of enrollment on that SNF or any SNFs that we've not received. At that point, payments will claims will be rejected, so payments would stop on 5/1/2025. And again, the TBD is on the website because it's not a regular revalidation. It is an off-cycle revalidation. So the TBD is on the website because they're not being asked for a regular revalidation. They're being asked for an off-cycle, which is due on May 1st. Great question.
Thank you for that. The next question we have is, can you tell me the best source for checking our revalidations? The Revalidation Notification Center and PACOS or the data.cms.gov?
They both are good sources, and that's a fantastic question. However, I do tend to lean towards the data.gov because that's available for all providers. If you're a provider that's submitted on paper, you're working with a provider that's submitted on paper, the Revalidation Center and PACOS won't be connected until you send in an application. So I would, again, you can use both, but I would lean towards using the lookup tool.
Great. That is all the questions we have at this time.
All right. Thank you, Karen. Great questions, guys. Keep them coming. So next we're moving on to submission options. So the submission options that you have are just like submitting an application for a new enrollment. You can submit it through a paper application or you can submit it electronically through PACOS. The paper application, I'm going to start there, that is a web-based application in the sense that it is a PDF template that you can complete information in using your computer. However, you then have to print it off and you have to mail it to us where it does need to be ingested into our workflow system. And processing time on a paper application is typically 30 days. There are just fewer automations that we can leverage. There's more manual entry from a paper application. With an electronically submitted application, which is PACOS, and PACOS is the only way to electronically submit an application. You cannot fax or email a paper application. If you want to submit it electronic, PACO is your route. But with PACOS, if you're already set up with PACOS and you submitted originally, it's super simple. You go in, you check the information, you make any changes, you send it electronically, and the processing time on a paper application is, if there's no development, is typically 15 days. So it's much quicker because of automations, because of verifications that we can leverage in that electronic system. Also minimizes the possibility for any typos on your part or the Mac's part. We do everything we can to avoid those. But again, with PACOS, it's just a lot quicker because we can auto-populate things as you entered them. We will talk about, though, how it's going to look if you've never submitted through PACOS. If you've never submitted through PACOS before, you can still revalidate through PACOS this time and start that process. So give me just 1 second. We'll talk about that a little more. Do want to just take one pause on the paper revalidations yet. The applications that you would use for paper revalidation are going to be the 855B if you're a group clinic or a Part B supplier, the 855I if you're an individual practitioner or non-physician practitioner. The 855I can also be used for providers that are sole owners, where they are the sole owner of their own corporation and they also are a member of their own corporation. They can actually revalidate both on that one application if they're both up for revalidation at the same time. That won't always be the case. They try to, but sometimes the timing is off. And then the CMS 855A. So I also want to point out with the SNFs, you do need to make sure that you're with all providers, but they did change this for 9/20/24. And with the SNFs, that 9/24 version is the only version that has the attachment, or that attachment information is available in PACOS, and we'll talk about that in a second. But those are the applications that you would use to revalidate through paper. For a PACOS submission. So if you're already set up with PACOS, you'll sign in as you would to submit an application. And what you're looking for here is the My Associates button. You're going to be able to do a couple of things. You can do account management if you need to, as far as access and how your passwords, emails, contact information for your PACOS access. There's also the Revalidation Center, and you can go into that, as we just discussed, to see if you're up for revalidation. And typically it does give you the option to revalidate through that button. It's not always available, though. We have heard from providers that sometimes that's hit and miss, and it could be how the provider has submitted applications in the past. It could be that it's not quite connected. So I always recommend going through the My Associates button. And when you get into the My Associates button, you're going to see a page that's going to show you all of your associations. It'll show you pending applications, applications that need signatures, applications that are in development, and it'll also show you enrollments that you're affiliated with. And That is where you're going to want to go to start that revalidation, because it's an application, it's not a process. You'll want to locate the provider that you're trying to revalidate. And from there, you're going to see a few things. Once you go into that, you can view the enrollment. So if you want to see what's currently existing, so you know ahead of time what maybe needs to change, you can do that. You can manage those enrollments there as well. That'll allow you to go in and give you various options to manage the enrollment. You will have a revalidate button. That's going to be one of your options. If you click on that, it will start a revalidation application for you. And then under more options, if you go there, it's typically where you go to submit a deactivation, a change, another initial enrollment, but revalidation is in there as well. So there's a couple of ways for you to start that revalidation, but you're going to want to start it with some type of revalidate button if you're an existing enrollment, because it's going to let you into that existing enrollment record so that you have the information so that you don't have to rekey everything. So it'll allow you to make the changes right in that enrollment record. So here I'm just showing you what some of those screens are. I mentioned about viewing the enrollments. I'm showing you where it is. The view enrollments, when you go into the My Associates, is going to have two sections, individuals and organizations. It would have information typically there. I do have this slide scrubbed just because of privacy reasons. And again, there you'll see that revalidate button again. And this is what that more options menu looks like when you get into it, where it shows you all of the types of applications that you can initiate on an existing provider. And again, I've highlighted in that red box that revalidate option. You'd select that with circle, we call them radio buttons. You'd select that radio button and go to the next page, and then it will let you start the application. And you'll know that you've gotten to the right place to start an electronic revalidation application for an existing provider when your screen looks like this. The scenario at the top, it's going to say, based on your response, the following application reason was identified. And it's going to talk about that the provider or supplier is revalidating a Medicare enrollment. And then you'd want to verify the name and the tax ID, whether that's an EIN or a social security number, and click on Start Application, and it will take you through the process, which will consist of reviewing the topics and making any changes. And we'll talk about that in a minute. So this is what an established provider is going to look like. This is that reviewing the topics. You're going to see the same topics list that you had when you initially enrolled the provider, but they're all probably going to have check marks saying, hey, I have information here, it's complete. If you try to submit without looking at those, you will get some warning messages, and it will tell you, well, you need to review all of these sections. So what you'll need to do is go through each one of those topics one by one, and you're going to have the option to verify. And you're going to want to do that. That will tell the system, yes, I've looked at it. And if you've not made any changes, I've looked at it, and what is here is correct. If you look at that topic and it needs to change, you will be able to make those changes. One thing I do want to point out, though, if you're removing ownership or managing control, or you're changing a practice location, the proper way to make that update is to end date it and add it back in, even if it's as simple as, say, a suite change, because it's historical data in our record, and CMS requires us to have those end dates so that we can track that change. You don't want to just edit over something. Most of the time, that's going to spur a development for an end date for the existing information. So just a tip there for you. Once you make those changes, you are going to be able to go through the normal process of signing the application with a current authorized or delegated official. It does not need to be all authorized or delegated officials. Remember, we're talking about an existing provider. So somebody who's on file that has the authority to sign enrollment applications for your organization, or if it's your provider, we do need their signature. And then you'll be able to submit that application, and we'll be able to process that from our end. Now, if you don't have any connections, when you go into the My Associates, a couple things are going on. It could be that the provider's established, but they always submitted paper applications in the past. So PACOS needs one application to be submitted to the MAC in order to connect the enrollment data. It's not automatic. You get a PACOS ID, it automatically knows who your enrollments are. It needs something to connect the two. So if you've never submitted through PACOS, but you want to do this, it's going to look a little bit different. And you are going to enter this like it is a brand new application. It's the same thing you would do if you'd had to submit a paper application. However, if you do your revalidation this way, in the future, you'll be able to see all of your information that we currently have on file. So it'll be easier to revalidate the next time. And it's going to look like an initial enrollment. However, when it is received by the MAC, we will be able to connect that to a revalidation request, and we will process it as a revalidation request, and it'll satisfy that revalidation response need. So even though it's submitted like an initial, it might feel a little uncomfortable, but it will come through and we will be able to determine, hey, they sent this in as a revalidation request. We're going to process it as a revalidation. Some additional reporting requirements when you are submitting your revalidations. Again, make sure that you have updated your license and your certification information. Nothing's expired. We don't necessarily need copies of the license if we can verify it on third-party source. Same with certifications. However, there are some non-physician certifications that are sometimes a struggle. And we made things like nurse practitioners, certain states, their licensure might not meet some of those requirements, physician assistants as well. We may need to get a copy of that in order to make sure that we can verify it. But we do everything that we can to try and verify all of this through, again, the state of licensure or the national certification body if we can. One other thing with license and certifications, if you're reporting a Drug Enforcement Agency certificate or a DEA certificate. That is something that we do have to verify if it's reported. And there are some security parameters that do make that a challenge because we are not those providers and we may not be able to verify that DEA in all cases. A DEA is not required for enrollment or revalidation. It's a nice to know, but it's not a requirement. However, if you are reporting it, please be sure to include a copy of the DEA certificate that shows the effective and the expiration date so that that can serve as the verification and it'll help you avoid delays. If it's reported, we do then have to request a copy of it. And I don't want you to get into a situation where you have to have your application on hold. So the next thing is IRS documentation. We do want to see the IRS documentation with the legal name and the tax ID. This verifies the legal name is connected to that tax ID. We do this for a multitude of reasons. One, to make sure all of our systems match. Our systems do actually ping off of the Social Security Administration and the IRS databases. We cannot see into that, but if something is mismatched, it will tell us and we'll have to develop. Next is the CMS 588 or Electronic Funds Transfer Agreement. This is something, we make all of our payments electronically. Nobody is getting paid on a regular basis through a paper check. There generally has to be some extenuating circumstance that CMS has directed MACs to pay utilizing a paper check. So really everybody's already set up an electronic funds transfer or that direct deposit. For a revalidation, a 588 only needs to be submitted with the revalidation if something has changed. So has the account name changed? Has the bank changed? Has the account number or the routing number changed? Now, if nothing has changed, you do not need to submit another 588. If there are questions, if they find something in the review, they may request it, but typically we do not need those 588s as long as nothing has changed in the system. And they will check that. Adverse legal action. So if anything has changed with any adverse legal action convictions, maybe it was a license suspension, maybe it was a revocation, maybe there was something with a penalty that falls under the realm of the adverse legal actions outlined in Section 3. With SNF revalidations, it'll be in that attachment 1. But if you have something to report, report it. Again, reporting something doesn't preclude a provider from being enrolled. It's something that needs to be disclosed, and the MACs may need to seek CMS guidance depending. Next is organizational structure charts, and this is going to be true of skilled nursing facilities. It's also going to be true of any entity that has a parent corporation or another organization that has ownership in it or managing control in it. We do need to see that organizational structure chart to ensure that we have all of the proper ownership and managing control information reported. And then also check to see if you need to pay an enrollment fee for this submission. So typically your medical clinics and your individual providers and your non-physician suppliers, physicians, are not going to be asked to complete that enrollment fee. An enrollment fee typically comes into play with some of our facilities and our suppliers. So please check that. You can check that in PACOS as part of the enrollment. PACOS will let you know if that fee is due and if it needs to be paid. We cannot process that application until that enrollment fee is received. But again, this is not something that is asked of individuals or those group clinics. So just facilities. That brings me to a break for questions. Karen, do we have any questions in the chat?
We have had a couple more come through, Leanne. The first one is, will the letters come from WPS or CMS?
Ooh, excellent question. They will come from WPS, so they'll come from the MAC. The other thing that I want to point out with that question is they're going to be sent to the correspondence address, particularly for the individual practitioners. If it's an organization or supplier, it will potentially also go to a practice location and a special payments address if they are different from the correspondence or each other. So you want to make sure that your correspondence, your practice locations, and your special payments are up to date. They will come from WPS and they will be very brightly colored. Typically, I cannot remember which one they are doing which color, but typically it's a combination of green and yellow. They want these to stick out like a sore thumb so that they don't look like something, I don't need to look at it. We do recognize sometimes those are going to the providers and maybe not the clinics they work for. They might not be getting to the right people. So check and see what your correspondence address is. You may or may not need to change it, but also I would suggest frequently checking that CMS data lookup tool for revalidations. Next question, Karen.
Okay, next question is, if you have a large medical group, is there a way to look up all practitioners that need revalidation under a tax identification number instead of individual practitioners?
There is. And I'm going to bring you back to the data.cms. There's a couple things. One, if you're set up in PACOS, you'll actually be able to see the reassignments in that revalidation tool inside of PACOS. You can also see to some extent in the data.cms. If you look up the organization, what I was showing you on, let me grab that slide. One moment, please. The results slide here. Here you can see it'll show the total providers receiving reassignment of benefits. It will show you that, and with organizations, oftentimes it will list it. It may not have their date. Well, I shouldn't say that. Sometimes it does have their date, but that's the best way. I would though in this case, lean towards PACOS because it's just going to give you a little bit more complete data specific to the group's PTANs.
Okay, that is all the questions we have at this time.
Okay. So next we're moving on to failure to respond. So what happens if the provider does not respond timely? So I mentioned payment interruption. So first I wanted to define what a non-response looks like. What do we consider non-response? So if there's no response to the initial solicitation letter, typically, again, that's 60 calendar days. Off cycles, it could be different. I've mentioned that 5/1 2025. That is the due date for all SNF revalidations, and we started sending those revalidation letters in late fall of 2024. So they're getting an expanded period or an extended period of time because of the information that we're asking for in that off-cycle revalidation. Typically, it has always been 60 calendar days. So weekends and holidays count. Bear that in mind. So if we hear nothing from the provider in 60 days, they will be considered in non-response to a reval request. The other thing that could happen, I mentioned the scenario where you maybe send that revalidation on day 50. That's a response. But if we have to develop, it's still a response. And then you're going to get 30 days to respond to that development request. If you fail to respond within the 30 days, and again, calendar days, weekends and holidays count, then that provider is now in considered as non-response, even if it's past the initial 60 days, because they made a good faith effort. We received the application late in their 60 days, but we received it. We reviewed it. We need information. We're going to give them 30 days to respond, not just the remaining of those 60. So keep that in mind. However, once those 30 days of development elapse, then if we still don't have the information that we need, non-response consequences will start happening. The other thing is if not just no response to the development, incomplete. So if we send out a development request, let's say 10 days in, you give us something, but it's incomplete. It's within the 30 days. We're going to work with you, reach out and say, hey, we still need X, Y, and Z. So within those 30 days, we're going to work with you. But if we get something on day 30 and it's incomplete, at that point, it's considered non-response. There won't be an extension. So please respond timely because it will impact your ability to bill Medicare. And we don't want that to happen. So what are the impacts? I mentioned stay of enrollment. This is, if you've been through this process before, we used to refer to it as append, but this is what they're calling it. They've made some adjustments in how they use it, but it's a stay of enrollment. And I have asked for some information to be placed in the chat about that stay of enrollment. And it is a Medicare Learning Network article that goes through what that stay of enrollment is and how it's used. So that stay of enrollment, the provider is still enrolled. The enrollment hasn't been deactivated. The PTANs have not been deactivated. It's an interim status. So if we don't receive your revalidation or a complete response to development, the provider would be put on a stay of enrollment. Claims will reject, but the provider's still enrolled and they'll reject, they won't pay, but once we get the revalidation process, that stay would be removed. If that stay elapses, then we move to deactivation of the billing privileges. And at that point, the enrollment record and all of the PTANs on it have been deactivated. It terminates all of those PTANs, so claims will deny, and it impacts, again, the entire enrollment. But at the point of deactivation, the provider would have to re-enroll, whereas with a stay, they still have a chance to submit that information for us to remove the stay. A deactivation is something where the provider actually has to re-enroll. So you want to avoid that. Again, respond timely. So some reminders and tips to make your revalidation process work more smoothly. Review your current enrollment record in PACOS if you've submitted electronically in the past and have access to that. If you've always submitted on paper, you won't have access to that, but make sure that when you send in the application, you're addressing all of the information on the enrollment. And that's true for electronic and paper. One thing I do want to mention here regarding the SNF revalidations, that new attachment PACOS, it's not a separate topic. The information from that, because it's managing and ownership control information, is part of the existing ownership and managing control information topics in PACOS, but you can only see it if your provider type is a SNF. So just bear that in mind. You won't see an attachment 1. And again, I do encourage you to take a look at that YouTube. It does talk through that and show you how to access that. One of my bigger things, and I've kind of talked about this a lot, is respond timely to the initial request and to the development requests, because they absolutely will place a stay or up until potentially deactivating your enrollment, which will stop payment for your organizations. And that is not something that we want to do. We want to get these revalidated and get you on your next 5-year cycle and move on to the next round. Remember that revalidation is per enrollment. So if you have a provider who's enrolled in multiple states or even the same state but has multiple enrollment records, that can happen with some of the facilities. You do have to do a revalidation per. So SNFs, again, to mention them, they're typically going to have one enrollment per provider number. They're going to have to submit multiple revalidations. Much of the information might be identical, but we will need those to come in as individual applications. And then lastly, PACOS, PACOS, PACOS. I will always lobby for you to submit through PACOS. It is, the submission is quicker. Unless you're having to submit like an initial, it will take some time, but then your future submissions and future revalidations will be quicker. Also, once we receive the application, that is also a much faster process. Again, processing within 15 days if there's no development needed on that application. So before I check in one more time for questions, I am including some resources in your material today. I have included the Program Integrity Manual, also known as the PIM, Chapter 10, which is the manual that oversees everything enrollment. And I've provided some references for things that do govern the revalidation process in general, the solicitation letters that is documented as to where we have to send those, and then also information about non-response so that you have that. I've included the Code of Federal Regulations, or CFR 424.515 that governs revalidations, along with that data.cms.gov we provided in the chat earlier. This is a link to that lookup tool. And the last two are just some resources on our WPS website, including a revalidation checklist. That checklist is a list of the things, it asks you questions, and then you check off the things that you might need in order to start your revalidation. So that may be helpful to you. So with that, I'm going to check in with Karen one last time. Karen, do we have any questions in the chat?
Hi, Leanne. We have had a few more questions come through. Let me scroll, make sure I'm not missing anything. Will there be information in the letters about where to get assistance if there are questions in the process of revalidating?
There will, and you're really going to be calling our call center. We do have provider enrollment specialized, or staff that specialize in provider enrollment, and they'll be able to assist you or connect you to provider enrollment if they need to. So yeah, I encourage you to contact our call center for those questions.
Okay, next question is, how long does a stay remain in place before deactivation?
So CMS will outline that, and it could be different. It is typically fairly quick, though. I think the longest stay that I've seen was 30 days, so it's not very long. It can be shorter. And again, that is set by CMS. And if you're put on a stay, you will receive a notification letting you know what your time frame is.
Okay, the last question we have is, can you submit your revalidation prior to receiving the letter? I noticed we have a due date of 8/31/25.
Excellent question. So you can, but there is a limit. That would be, if the letter hasn't been sent, it's referred to as a non-solicited revalidation because we didn't ask for it yet. However, you have a due date. So at this point, you'd want to look to see how far out is that due date, because at some point, a lot of providers are going to have due dates that are years out. So we do need to be careful. Any revalidations that are unsolicited, meaning that they're coming in before the letter, will be returned if they are submitted more than 7 months prior to their revalidation due date. So you can send it in early, but it's that 7-month window that's the sweet spot. So if, say, that were 8/31 of 2025, I would say hold off because, or excuse me, 26, my apologies, because we are more than a year out from that. More than 7 months, you do not want to send that in. However, we're looking at August, we're on April, we're about 4 months out. that one I would say you could, or I shouldn't say probably, that one you could submit and it would be processed and you'd be ahead of the game. Excellent question.
Hey, that is all the questions we have.
Okay. So we'll go ahead and wrap up. So in a few minutes, you are going to receive an email thanking you for attending. Don't delete that until you look at it. If you're attending today and would like continuing education credits for an accreditation or certification body, this is your certificate of achievement. The email includes a link to the survey for today, and it also, at the bottom, you'll see in that bottom red box, it includes your certificate of achievement, and it has the date of our session, and it will have the time. This email can be submitted to your certification or accreditation body for those CEUs. Now, if you didn't get it, a couple things might have happened. This is an automated email that comes from our webinar software, and the sender is WebEx. It may have gone to your junk or your spam. So check that. If it did go to your junk or spam, consider adding that sender to your safe senders list so that it doesn't go there in the future. The other thing that could have happened is you joined by phone today and the system simply cannot confirm your attendance for today's session. That's okay. In either situation, you are, I do have a plan for you. So what you're going to do is if you needed a certificate and you didn't get it, you're going to send an email to that WPS GHA mailbox that we provided earlier, and I'll ask Karen to put that in the chat in a couple of minutes. But you'll be able to send it to that and let me know you need a certificate, but also let me know the phone number that you attended from, because then I can manually confirm your attendance. I can create a physical certificate and I'll get that emailed out to you so you have it. Follow-up questions. I will continue to take follow-up questions if you think of any for the next 7 days. Just submit them. You're going to use that education mailbox. And in the title, if you could put provider enrollment revalidations, that's going to let the individual monitoring that mailbox know, hey, Leanne needs this to get a response to the provider. So I'll get those questions for you. If it is claim specific or if it's specific to a revalidation application that's in process, your best bet is still to contact customer service because they'll be able to access those claims or those applications and advise for that specific situation. But anything about the revalidation process in general, feel free to send those my way. As I mentioned, as we got started today, you are going to have an opportunity to provide some feedback. I want to hear from you, and I would certainly appreciate it if you take a few minutes to provide me with some feedback. What did you like about today's session? What did we do well? What could we do better? What could we add? We want to know so that, again, we can improve this session. This is something that we will offer again further down the line for providers that are about to embark on their revalidation journey. So we certainly want to hear from you so that we can make this a valuable course for all. Also, this is your opportunity to provide us with feedback on topics you'd like to see in the future. We want to make sure that we're developing education that meets your needs and that you find value in. So I thank you in advance for taking the time to complete that. You're going to have a couple of ways to access that. Karen just put a link in the chat. You can click on that and it will take you to the CMS Qualtrics survey. Also, when you leave this session, you're going to get a redirect, and that's the image that you see at the bottom of the slide. It's not malicious, it's not spam, it's not taking you anywhere you don't want to go. It's just letting you know that you're leaving this session and you're going to the Qualtrics survey, which again is that same link Karen sent, and just letting you know that's where you're going to provide that feedback. So again, appreciate your time with that. And that will end our presentation for today. On behalf of myself, Karen, and everyone on the WPS Provider Outreach and Education team, I'd like to thank you very much for taking the time to attend today. We're all super busy, so sometimes I realize sometimes carving out this time to attend a webinar can be a bit of a challenge. So again, I thank you for that. Again, thank you again for taking some time to complete our survey, and I'm looking forward to seeing the topics you'd like to see in the future. That again ends our session today. Have a great day. Be well. You may now disconnect.